In January of 2020, most Americans had never heard of the novel coronavirus. And now not a day goes by without all of us thinking about COVID-19 and the disruptions this disease has caused in our lives. For some, it's been a tragic loss of life. For others, it's been a loss of their hopes and their dreams. And with the worldwide casualty rate at more than 1.7 million people, there's never been a pestilence that enacted such damage. But little more than a month ago, Hope with the Spirit emerged with the announcement of not one, but two new vaccines to help defeat this awful plague. Sam, there has been some criticism of Governor Larry Hogan for the slow rollout of the vaccine, with only 1.7% having been vaccinated to date. Is this criticism fair?
Well, Casey, some of it's fair and some of it's not. If the president had invoked the Defense Production Act, obviously there would be more vaccine to distribute to more states, and Maryland would get a better share, which means Montgomery County would get a better share. We've given out this week 6,700 shots. That was our allocation. And we have the capability of giving out over 100,000 a week. So yes, in that way, the governor really is not culpable, except he could yell more, but he does a pretty good job of that. But the biggest thing is not releasing the rainy day funds. We need those rainy day funds to set up more inoculation centers and more funding to be able to get the shots out faster and wider throughout the entire state, and especially here in Montgomery County.
County Councilman Andrew Friedson put out an email yesterday, and he said that the county was prepared to do 17,000 to 24,000 immunizations a week. If you do the math, then if there's with 1 million people in Montgomery County, we have more than that actually, the minimum we'd be finished with these vaccines would be 42 weeks. That does not seem very good to me.
Well, today at the county press conference, it was announced that the county is hoping on Tuesday to get 10 to 15,000 vaccinations. That's all they get. And there isn't more. States like Virginia, which is larger in population than Montgomery County, does get more than we do. But they are getting them out, according to Mr. Elbridge, as fast as they can. And what is interesting that I just learned today, that Johnson & Johnson has a new vaccine that could be approved within 6 to 8 weeks. Only one dose and no severe refrigeration. So if that's proved to be effective, that could be the best thing we have waiting for us.
But furthermore, we only have one.
Hold on, Sam.
Set up.
I want to hear from Sam. I want to hear from Mark on this.
So I was just going to say that one of the issues here is not necessarily the inventory of vaccinations. Is we were seeing a problem where vaccines are available, but they're not being used. And this is really where states and localities need to be flexible in not just having this narrow criteria, because if the people who fit that narrow criteria don't show up, the vaccines go to waste. So there's a balancing that you don't want to be overly prescriptive in determining who gets it if it means that people don't actually get the vaccine.
And if to address your point, Mark, I think we ought to have a wait list for people who are able to respond within a half hour of being notified that someone didn't show up for their vaccination, in order that dosage doesn't go to waste. I'm not sure if that's being done or not.
Well,
but I want to
vaccination centers, Casey, at the end of the day, they have extra shots. They're asking all the volunteers there who need a shot to step forward and get a shot. So, that's one of the issues. But if we had more money, we could set up more sites and more.
If we had a vaccine, if we had a waiting time. If we had a waiting, an extra center doesn't do any good if you don't have the product.
And we don't have enough product right now.
Right, we don't.
We don't.
Ladies and gentlemen, up until a month ago, we didn't have a working vaccine. And the fact that we have 3 vaccines possibly within the space of a year is an absolute miracle. It hasn't been done in medical science before. So we can kvetch about should they have bought more dosages or not. The fact is they didn't know it was going to work.
Well, it's working in North Carolina. My parents are getting theirs. They already have their 81, and they've already had their, they're getting their shot on the 27th of January. They're not in a nursing home, so they're in the 1B category. You know, so
Folks in DC age 65 and up are getting shots this week.
Okay.
We're not.
New York has just lowered its age limit to 65 from 75 for the second tier of vaccinations.
Again, they may have more vaccines than we do. You know, that's the
Or they
whole
may have
issue.
better or they may have a better governor. Who knows? Anyway, Mark,
I did
the
not say
Montgomery
that.
County School Board has pushed back the return date for schools to March 15th, in part due to the increase in number of COVID-19 cases recently, but also in the hopes that the teachers will have been vaccinated by the time school opens. Is this a wise decision?
Well, one of the criticisms all along of MCPS's response to this has been they have had this either we're open or we're closed response, as opposed to what a lot of people advocated from the very beginning, which was to prioritize students, and again, with teachers who are prepared to go back, prioritizing students to go back. So younger students, students with learning challenges could have gone back earlier on. Obviously, not obviously, but older students, those that for whom the remote classic works a little better. Unfortunately, that's not the approach that MCPS has been taken. It's kind of either we're open or we're closed.
Well, here's a shocking statistic that when school resumed after the Christmas break on that first Monday, 25% of all students didn't log on. It means once again that our students are falling farther and farther behind. And I want to turn to Lori about this because many private schools have reopened, Lori, because of a concern by parents about social isolation and the fact that they need in-person learning. And this has actually caused a decrease in the number of students enrolled in MCPS schools. So what is the outcome of that going to be?
well, about 5,000 people fewer are in school this year. That's a big change in how the budget is going to be determined. And currently the budget's based on enrollment. And the proposed budget is for $42 million decrease than last year, but that happens to be $39 million more than the maintenance of effort amount, which is the amount the state sets for our county. So, are we gonna, are elected officials gonna vote to go above the maintenance of effort when our budget is severely impacted by COVID? I don't know. The number of teachers that we need we probably need them to help to, the kids are going to come back with a lot of needs that, mental health needs and catching everyone up academically. So it's going to be a huge challenge. We need the staff, but I don't know if we have the money.
And another issue is access to broadband. Folks in the upper county just don't have access to broadband, so the kids can't get on for education and for learning purposes. And I know the council's been working on that.
Thank you, Sam. Now, Susan, while we're discussing the school situation, the county council has been debating whether to eliminate police officers being stationed in the schools as resource officers. And this past October, all 25 Montgomery County Public School Systems principals told the school board that they support keeping the school resource officer program in place. So what is the effort in the community to kill this program? If the education is valuable.
This has gone on back to the 1990s. There's been an effort afoot by some organizations and individuals that this is a terrible thing to do. And from what I'm hearing is it's not going to pass. The school resource officers are going to be there when they go back to school. They serve a useful purpose. And in today's time of unrest, I don't think it's a good idea to let them go away.
But why is there the effort to even eliminate the program when it seems that the educators so universally endorse it?
The effort to remove them has essentially been in minority communities. And the thought is that it's discriminatory, et cetera. Over the years, there hasn't been an incredibly valid reason to do it. and it's why it has not taken place, although there is now, in the time of police reform, you know, an effort to change things about. But it isn't going to happen. It's going to stay where it is, and it serves a useful function.
School resource officers help to prevent crime. I personally have shadowed an officer for a whole morning and saw the value of this. You know, there were 2 incidences that occurred during that time, and I saw the great value and how well they work together with the principals. It's a vital program, and in the past, the Montgomery County Council PTAs have greatly supported this. I haven't heard much from them this year, I think because there are some parents who feel otherwise now because of this whole defund the police movement, but I hope that we can keep our SROs.
And they also work with the middle schools and the elementary schools that move on into the high schools. And so it's the whole system. They get to know the kids, the schools, et cetera, and it needs to stay in place.